I am live. How great it is to be alive in such an amazing time of human endeavors. Yes, there's some bleakness and yes, there's some challenges, but the more I meet amazing people like tonight's guest and some of the amazing physicians and nurses and researchers that kind of are in a satellite around me, I get a lot of hope that by learning more about our health and learning more about how we can optimize our life, I just get a sense that we're going to be okay, that we're going to get through these difficult and dark times. This post the pandemic, yes, post economic, real economic swings, but we're okay. And the research that I discover almost daily, and we're going to talk about some of that tonight, just makes me feel like there's good work going on under all the shadow. So, I am Tanya Abreu, and this is Rethink Your Health. Just a reminder, you can see all of our podcasts on Rethink Your Health YouTube. We have a website, and that's www.rethinkyourhealth.com. And so we do far more than podcasts. We do daily blogs. We do product evaluations and reviews. We do interviews. We do inspiration. So please, 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 www.rethinkyourhealth.com. And if you haven't subscribed to us, please go online and please do so. I'm going to go ahead and put that up on the screen so that you can do that right now as we're getting ready to meet tonight's guest is a retired osteopath with years of experience working in the field of osteopathic medicine. It is a growing it's a growing medical degree. Many of you have seen DO after your doctor's names. That's a doctor of osteopathy versus MD, which is a medical doctor. And I think we're going to bring on Dr. Susan Hall to talk about that difference right away, because I think that it is also a sign of positive, optimistic, changing times. Good evening, Dr. Hall. How are you?
I'm very good, thank you. And I appreciate you having me on your podcast tonight.
Good. You're going to help us rethink our health. You're going to help us rethink what it means to be well in body, mind, and spirit. And I guess the question that lots of people have and they don't ask, and that is, what is the difference between an osteopathic physician and a medical doctor in training and perspective?
I'll be glad to answer that question. Tr- Essentially, medicine is medicine, and MDs and DOs learn the same medicine. In the osteopathic medical arena, we have about maybe 1,000 hours more training in the practices and philosophy of manipulation, which is kind of cousin to chiropractic, but it's approached in a different way. But the body is the same. Many people that are aware of anatomy realize that blood vessels, nerves, and the lymphatic system all travel in bundles. So when you go to a chiropractor, they approach things from a nervous system point of view. An osteopathic doctor will approach from a lymphatic point of view. And the manipulations that we do to affect the body pretty much do the same thing. The reason that manipulation and chiropractic adjustments are beneficial and help with symptoms is if you can consider the spine and the muscles of the body connected to that spine. And if the spine is twisted, there's more tension on those muscles. Well, these bundles run through the muscles. So if you can uncoil the spine, you're going to relax the muscles and you're going to have better blood flow, better lymphatic flow, and better nerve um, connections.
Wow, that is so succinctly said, Dr. Hall, because I have had DOs in a hospital setting, and they've never talked about any of that, nor have they done any manipulation. But I had heard that, of course, even with the word osteopathic, we're talking about bones, and the way we're talking about the release of muscle, the way we talked about releasing the tension, right? So that there's better blood flow is absolutely amazing. So tell me what you have done. How long were you a practicing osteopath?
Well, prior to me going to medical school in Iowa, and I'm a South Floridian, so that in itself was um, an event. I went to the University of Florida and got my degree in physical therapy. So I've always loved to be able to affect people and get them better. So my osteopathic training, I graduated in 1983. I did an internship in 84. And then I went out to San Diego to do a sports medicine fellowship, which was a new emerging specialty. And when I came back, it was difficult to get a sports medicine job, being female, not being orthopedic. So essentially, I migrated from general practice to occupational medicine. And basically, that's when you get hurt on the job, you go to a specific clinic, and the medicine is the same, it's just different paperwork. So I've been retired about 9 years now, and I was introduced to this company, LifeWave, who I'll tell you about in a few minutes. Or I can tell you about it now. I think Tanya has left the building. Let's see what else I can share. I'm very active. There you are.
Yeah, I'm sorry. I had a few technical problems,
Okay.
and I had to jump off for just a second,
Okay.
because basically my computer fell. But I heard every word that you said. So what a great background. And one of the things that you strove to do is find what really contributed to human fitness, what really contributed to optimum performance, both as a doctor, as an osteopath, and as somebody who wanted to heal people. Now, let me ask you, because of course you practiced during a very traditional time of medicine, right?
Yes.
Let me ask you, um, what were your challenges? What did you wish could be different in the decades that you practiced? Um, what did you learn by being an osteopath in a non-osteopathic healthcare system?
I learned that there are some prejudices, DOs and MDs. I learned that there's some ignorance because there's many in the public that they don't know what osteopathic medicine is. So you have to educate the patient. But again, the medicine is the same. The challenges were in the occupational medicine arena of really being the advocate for the patient when you're being employed by the facility. I always advocated for the patient and just tried to do my best to get them the best care and to be able to recover as best as they could.
Okay. Well, I have gotten feedback that people can't hear me, and it's very frustrating that there is a really bad feedback. Um,
For
I
me,
Yeah, they can't hear. Now I have just four that came in. Oh, I hate to do this. I hate to do this, but let's re-record. Um, I don't know what the problem is, but what we can do, Susan, is we can record not live, and then I can broadcast it.
Whatever you want to do, Tanya.
Okay, because you hear me, and that's why I kind of thought it was going to be okay, but
Nobody
it
else can hear you.
no, no, no. Your guest sounds very interesting, but
Uh-huh.
yeah.
Can they
Oh,
hear me? Can they hear me?
yes, yes. But the feedback is so bad. So
Why don't
let's
you do what you need to do?
Yeah, well, what we're going to do is go ahead and re-record so that it is a better quality because you deserve the best. I can't wait to start talking to you about LifeWave and
Thank
stem cell.
you.
So,
Okay.
all right, everyone, I apologize. We've had some technical difficulties. Um, Now, someone said I can hear. I can hear. Oh, we have a Dr. Dietrich Gorman, a DO. Um, well, if people can hear, let's move forward because I, thank you, Dr. Gorman. I'd love to know more about what you do. So, um, you you're saying, and I don't mean to put words in your mouth, but the osteopathic tradition is a little bit more of a patient advocate.
Well, I would hope so, but I mean, that's just how I practiced. I always wanted to do the best for the patient, regardless of the bureaucracy. And
Hmm.
so I just approached medicine from a patient first kind of point of view.
Hmm. Okay, so now, before the feedback interrupted me, you were talking about as a physician, you discovered something called Life Wave. And how old is the company?
Okay, well, let me explain. I retired from medicine about 9 or 10 years ago, and LifeWave, although it's been in existence for about 20 years, I was only introduced to it about 3 years ago. So I, not being a physician, but still wanting to help people, discovered this company. I was very impressed with their research and their success, and it's a natural product. So if
And
you like, I can
what is it? And
explain
what is it?
what is it. Well, LifeWave is a patch that goes on the skin, and it works immediately in the body. Now, I won't get too technical, but essentially there is light energy emitting from your body. Um, People don't see it because they don't have the type of eyewear, but you can see it on night vision when there are bodies moving. Everybody's seen some soldiers that they can tell that there are bodies there. So you have this emission of energy, and when this energy interacts with the patch on the skin, that is sent back into the body, and through a copper peptide, and we all know how important copper is, it goes and finds your body's own stem cells, which everyone has, but they decline in number with age. And what the patch does is it regenerates, rejuvenates, and replicates your own body's stem cells. And then when you have the stem cells available, basically they're like the army of the body. They're able to morph into whatever type of cell the body needs. I've seen some very dramatic responses to people putting on the patch, primarily with pain. And there are neuropathies that have been improved. There are all kinds of benefits. I mean, there's a wound healing because there's a lot of collagen involved, rapid pain relief, greater energy, sleep benefits, and I can tell you that when I started using the patch, my dreams were very vivid. Improved skin appearance, dramatic anti-aging, and I hate that term, anti-aging. Faster recovery from exercise and reduced inflammation, which is associated with a lot of pain. So there's tremendous amount of research and science evidence on the website. And the biggest challenge with this product is that not everybody can feel it working, but we know that it works.
Mm-hmm.
And what I tell them is, well, you can't feel yourself aging, right? I mean, feel
But
it,
we are.
but we are, and you can't feel the age reversal benefits of the patch. What I try to tell people if is after doing their own due diligence about this company and the product to just try it.
Mm-hmm.
And if sometimes you'll be amazed, and it's very subtle sometimes. The older you are, the longer you should give it the old college try. Like if you're younger, maybe you try it for a month. If you're older, then 90 days. And there's a money back guarantee. And I personally don't know anybody that's asked for their money back. But I'm open for anybody to call me, go on the website. If you have any questions, just get in touch with me.
Okay, so we have a couple of questions coming in. Now, I have been doing a lot of research recently on stem cell, for joints, stem cell from your own body that then gets injected back into your joints to promote collagen. You're saying that this copper peptide is kind of bounces, for lack of the science in my language, kind of bounces back into your body and stimulates stem cell activity.
Correct. Now, let me tell you about the injections. I have people that I know that have had the stem cell injections, and generally speaking, it's very effective. It's very effective. It's very expensive. It's like $10,000 to $15,000 a pop. It's invasive, but it is effective. The
Mhm.
problem is, I don't know a lot of people that can afford $30,000 or $40,000 a year to continually get stem cell injections.
Yeah, like what's Tony Robbins? Tony
Well,
Robbins had, he's essentially a giant. He's
yeah,
genetically um,
I know. Like a
malformed, and
Morphan syndrome.
yeah, and when he turned 50, he started not being able to walk, right, because of his hips. And he started on this, he was all about making money. Now he's about life force and health
Yeah,
because he discovered that stem cell could cure.
right.
And it's interesting because now he's talking about his goal is to make stem cell therapy available to everybody, whether you have cash or not. Not, of course, in the injectable, but perhaps,
Yeah.
I think he's leaning towards the types of technology that perhaps LifeWave uses.
Well, LifeWave product is very affordable. It's like $4 a day,
Hmm.
and and it helps people. This is what's so exciting.
Now, we
Um,
have a question. Can you use this if you have a pacemaker?
yes, because
Mhm.
there's nothing being added. You should always check with your doctor who put the pacemaker in, or your cardiologist. But there's no medication. This is not any kind of transdermal patch. All
Mhm.
this is stimulating your own body. So personally, I can't see where that would be a problem, but it's always recommended to check with your doctor and have your doctor research and then tell you, yeah, it's okay.
Mhm. And so, can you talk a little bit outside of LifeWave about what we should know about stem cell? What is it, and what should we know about it as consumers? Many people don't know what it
Stem cell,
is.
yeah, well, it is a type of cell that goes around the body and helps repair it. And the uniqueness of the stem cell in your own body is that it can morph into whatever kind of cell the body needs. Very, very unique. Very, very unique. And people have been keeping stem cells from umbilical cords for years. And so
I
it's that
remember that because I worked at a maternity hospital.
yeah,
I remember that was
people,
such a big deal about keeping the stem cell.
cord blood, right? Exactly. So this David Schmidt, who is the CEO and founder of LifeWave, has been working on this technology for 20 years, and it is a wonderful natural wellness product that's helped thousands upon thousands of people. Everything from neurological and seizures, headaches, the heart issue. There's evidence that these patches help reverse the aging of some of the coronary arteries. It helps with the gut. It helps with joints, neuropathy, sleep. I mean, here's the thing, in my opinion. If you can help people sleep and if you can help people get out of pain, you have a friend for life. So, my recommendation is do the research on the website and give the product a try. And I think they will be very, very, very excited with the results.
Well, I want to stop you right there. You just said lack of sleep and pain are the two major causes of disease. Can you talk a little more about that?
Well, I didn't exactly say that, but if you can help people sleep better, their body's going to recover and you're going to have less stress and less inflammation. So you'll be healthier. Pain is from inflammation. And anybody that's had chronic pain knows that it affects not just the area of pain, let's say it's your knee or your foot, but like as an example, if you have pain in your foot, you're not going to walk normally. So if you don't walk normally, then that sets up all kinds of maladies um, upward, like into your hips, into your spine, even headaches. You can get headaches from bad walking. So but inflammation is one of the reasons people have pain, and oftentimes what we consume in food and drink creates more inflammation.
Like what? What would you tell a patient that was in chronic pain?
What would I what?
Tell a patient that is in chronic pain.
Well, I would suggest that they try all kinds of conservative measures, including physical therapy and then depending on their diet, to consult a dietitian or excuse me, a nutritionist, and that's their expertise is what foods to avoid when you have chronic pain, when you have inflammation.
Okay. Okay. So in your years of practice as an osteopathic physician, what what did you do best for people that surprised you? What kinds of things that you could do for your patient
Okay.
that actually affected better health that you were actually surprised about?
Oh gosh. Um, Gee, that's a tough one. It's oftentimes people ask me, well, what was your specialty? And
Yeah.
my response was compassion.
Oh,
I entered medicine because I felt it lacked compassion. And when you put your hand on someone's shoulder and you really engage with them in conversation versus sitting on the other side of the room and just not even looking at the patient, I think when you have a better connection with your patients and you show that you care, it makes a big difference in their healing process.
mm-hmm. Mm-hmm.
So um, I wish I had LifeWave as part of my armamentarium when I was in practice, but I didn't know about it then.
Yeah, yeah. Well, things are changing so rapidly.
Yeah.
Things are changing so rapidly in the field of medicine, in the field of preventive disease. And every day we need to look and take a look deeply at the research. I will be honest with you, Dr. Ha. I had heard about LifeWave a few years ago through you, actually. I've known you for quite a while, and I have great respect for any osteopathic advice. And so I looked at it, and it just seemed so mystical
Yes.
that I couldn't quite believe it. This is me, and I'm a person that, is easy to believe, and I didn't try it. But then just over the past year, I've been learning more and more about that energy, about copper, about all of the things that can actually cause our bodies or help our bodies to heal themselves. And I have never understood this stem cell connection until just recently. So I'm going on, and I'm going to put the site up again. Um, we have a question from Dr. Gorman, who is a practicing DO right now. And she's asking you if you're personally using this product and what improvement have you seen? Good question, Dr. Gorman.
Absolutely, I'm using this product. I've been using it from day one, as soon as I was introduced to it. And again, I'm very fortunate that I don't have serious and challenging health issues. But I know that it's working. I'm confident that it's working. I do sleep better, and I know that because of my dreams are much more vivid, that I know that it's working.
Interesting.
I've heard thousands and thousands of testimonials, and I'd like to share something very close to my heart. If you can just give me a few minutes. I have available to me a video of a woman with, I'll call it Alzheimer's. And on day one, they videotaped her prior to her starting the patches, X39. She was unable to answer the basic questions about her phone number and her granddaughter's name and her address. And then 15 days later, they videotaped her again and they asked the same questions. And there was slight improvement, but not wonderful. And then on day 30, and this literally brought me to tears, they asked her the questions again. But prior to even her opening her mouth, you could see that there was an aliveness on her face. If you know people who are kind of gone consciously, they have a very flat affect. So this woman had a smile on her face, and she could answer every single question, excuse me, that they asked her. And that to me was mind blowing, that in 30 days she could improve so much. And I also felt for the caregivers of these people.
Mhm.
So that alone would be
And
enough
people,
to try
and
it.
people can get this video from you. This is
if
Dr.
they,
Hawk can
yeah, if
be.
they connect with me, if they leave me a message with their email, I'll get it to them.
Okay. So Dr. Susan Hall is on LinkedIn, so you can link her there, but you can also call her directly or text message her. This is her cell phone. Now, it's interesting because I have been doing some research around what causes um, increase in chronic disease. So let's say you have MS or you have fibromyalgia. What are some of the things in life that can exacerbate the symptoms? Also, with things like cancer, heart disease, anything that's chronic and potentially fatal. And one of the things that I have seen over and over again, especially with autoimmune disease, is the lack of familiarity, stability, security. And while we know money can't buy happiness or money can't even buy health, hello, Steve Jobs cannot cure cancer, we also know that feeling financially secure helps your overall health.
Absolutely.
And it's funny, Susan, I've known you for years now, and just recently you've turned your attention to a group that just won Best in Class as a financial advisory group. And that group is called the Premier Financial Alliance. And so you are a physician talking to other physicians and to consumers
Mhm.
about a new way to think about life insurance and investing, correct?
Yeah, tax-free investing.
Can you talk a little bit about how we know that makes us feel healthy when we have a but what,
Well, I heard a statistic not too long ago that a majority of the foreclosures on homes is due to medical debt. Stunning. Okay, with that we're in this country, and this is what's happening. But Premier Financial Alliance is the marketing company that markets the insurance products of National Life Group, which I just told you is the best in the business. And I'm in the process of learning more about the company and their products. But when you can grow a nest egg tax free inside of a life insurance policy where you're not going to lose money, you can only make money. I think that's a great product. But what sets National Life Group apart from most other insurance companies is that they have living benefits. You can use your policy it, while you're still alive,
Mhm,
and that's huge. It can cover chronic illness, chronic like if you have an accident, chronic injury.
mhm.
There's just it's terrific. I mean, why wait till you're dead to use it? It doesn't work then. So good
Mhm.
for you. So this is an opportunity to to build to build wealth in a tax-free environment. And what's interesting is most recently I was introduced to another aspect from the National Life Group that you can have your church or your temple as part of the beneficiary, and the company will match your donation to your church up to $30,000. I'm just learning about that program now, but what a great way to bring your religious organization into a program like this.
I thought it was particularly interesting because, life insurance is morbid.
Yes.
And this fact, and I did a lot of research before I thought we would talk about it on our podcast. But this National Life Group has this very innovative product where you actually get the benefits of that life insurance while you're alive, and that
Yes.
is amazing.
Yes.
So, what I really like, what I really want to stress to the people who are listening and watching today is the following: whole health has nothing to do with the numbers on the scale, the numbers of your blood test, the numbers of your blood pressure. That's just a tiny part of the picture.
Right.
Whole health has to do with security and fitness in every aspect, whether that's mental health, family relationships, financial security, and certainly this down to the very cellular structure and energy of our body.
Hmm.
I I had the delight, and I'm glad we have another osteopath on the phone tonight. I had on the podcast tonight. I had I read about osteopathic physicians, and one of the things that they say, the difference between a medical doctor, an MD, and a DO is the DOs view the body as more whole. right? It's almost the original integrative medical specialist, right? Because you have one spine that's connected to everything. It's not like you have a urinary tract infection, reproductive health, gastric, and most doctors think of those things separately. Here, let me send you to a
Right.
specialist, right?
Yeah.
Where it seems that osteopath, just as yourself, retired or no, is looking at a bigger, broader picture.
Right. Yes.
Yeah, for sure. And I think that's really, really exciting. I'd love to get and Dr. Gorman, please link me, please inbox me and let me know what you think. Um, I am just really happy that we had a chance to talk to you, Dr. Hall, because it's really hard to find people that are Renaissance physicians, really people that are looking at various parts of wellness and life and health as you do. I ask this question a lot on Rethink Your Health, and I'm going to ask you. The question is, you used to think, maybe before you became an osteopath, or maybe when you retired, let's do it this way. When you retired, you thought that health was blank, but now you think health is what?
When I retired, I thought that health was an emerging concept. You know, we have sick care in our country. And until we flip that to wellness care, we're always going to be treating sickness and illnesses. Um, I really admire the researchers that are looking into how to prevent illness and how to do some of these cures. And I also have to put some of that responsibility on the individual. I'm of the philosophy that we all abuse our bodies. We all abuse our bodies. It's just to a degree. So if we can get into the mentality of this is our temple and we have to take care of it by what we eat and how we exercise and how we think and stimulating the brain, um, we have to take responsibility for our own health. We can't leave it to the doctors.
Hmm. And
So,
you're absolutely right. I mean, I think even growing up, we're going to go to the doctors, and the doctor's going to tell you exactly what to do.
well, with the internet now, we can find out what to do and
Hmm.
not leave that responsibility to the doctor. Doctors are necessary for when we're sick. They have to order medication. They have to give us shots and whatnot. And if there's a lot of pain, there has to be an evaluation. But as I said before, we have to take responsibility for our own health and we have to educate ourselves and we basically have to eat right.
Yeah, yeah.
And as
Hard
you
to do, right?
yeah, and as you mentioned, financial health is going to be much better because it reduces your stress.
Hmm.
Stress is a killer. You know,
Yeah.
stress is a killer. I mean,
What do they say? 98% or something like that of all diseases has a root stress
well,
involved.
it's one kind of stress or another. You're either stressing your body, stressing your mind, or both.
Hmm.
But
Hmm.
one of those terrible diseases called shingles is really rooted in yeah, the chickenpox virus is in you, but it rarely comes out unless the body's stressed.
Yeah.
And
Yeah.
it's so that to me is a very typical stress reaction. And
And
it's
I love what you just said. Used to think that this health was this collective kind of emerging concept, and we were going to get to wellness care from sick care. But now you've got this little bit better, I think, more precise idea that health is about individual accountability for lifestyle. You need to do the research, no matter what your age. You need to understand what science is saying, and you need to believe in what you think your body is saying.
Right.
That's great. Now, before we sign off, I'm going to put your number up again because I've had people ask for it. So there it is. Dr. Hall can be reached at 954-417-5723. And as you can see, she loves to talk about innovation in healthcare. She can point you to that video with the LifeWave
Hello.
science,
Yeah.
as well as some talking about life insurance. I've put off getting life insurance because it seemed like such a waste of money. It's better maybe to put it in an estate for kids, but this is similar, is
It,
what it is.
it's better. It's actually better. But I don't want to forget, when they call that number, more than likely, because I won't recognize the number, to please leave a message.
Mhm.
I'll get back to you.
And
Okay?
they can also text, correct?
Absolutely.
Okay. Well,
You're
thank you so much, Dr. Hall. We will be in touch. Everybody, I want you to once again look at this. Let me go up here. Uh, LifeWave is the product that you referred to that helps your body stimulate growth and of its own stem cells,
right.
which are really, I don't want to say anti-aging, but they're pro-aging, right? It helps us live healthier, optimized lives as we go into our 70s, our 80s, and beyond. So thank you.
My
Thank you.
pleasure. Thank
There
you.
you go. All right. Many blessings. Thank you, everyone, for watching. And I'll see you next week when we have an ND, a naturopathic, who is also practicing quantum medicine based on the principles of quantum physics. That's Dr. Elizabeth Boland. So have a great week. Happy holiday season. See you all soon. Bye bye.
Stay well.
Love